So today is March 29th, 2021, and I've got some vaccine updates for you for people on prednisone. It's always been a real mystery about what people on prednisone should do about getting the COVID vaccine because we were all excluded from the trials. None of the vaccine trials included people on prednisone or any other immunosuppressants. They wanted to make sure that they were testing it in people who were most likely to have a proper response. And they didn't want to throw any immunosuppressed people into the mix to potentially ruin the results. So now that time has passed, there's more data and I want to share that with you. So last week in JAMA, the most foremost research journal in America, the Journal of American Medical Association, they published an article about people who had a solid organ liver transplant, a solid organ transplant. So that's either kidney, liver, lung, heart, one of those solid organs they had transplanted. And because of that transplant, we're taking immunosuppressants. Things like prednisone. Prednisone could have been one of those things. And the other medications they could be taking include tacrolimus or mycophenolate mofetil or several other options. And what they did was find out whether these people had an appreciable immune response after getting the vaccine based on measuring their antibodies. So they found these people on social media. They said, hey, if you've gotten a transplant and you're getting the vaccine, let us know and we'll measure your blood to see if you have any antibodies. And so all these people volunteered, totally volunteer-based trial. And the people were mostly healthcare workers because this went from December until March. And because they're healthcare workers, they kind of knew what to expect as far as like getting their blood drawn and things like that. They knew what they were signing up for. And they also were really concerned getting COVID because if you are immunosuppressed because you're taking prednisone or another immunosuppressant, you are, according to the rheumatologist, this is what they said. After considering the influence of age and sex, people like with rheumatoid disease are at higher risk for hospitalized COVID-19 and worse outcomes compared to the general population. So that's pretty much true of basically everyone on prednisone. You're at higher risk of worse outcomes if you get wild infection of COVID. And so you want to do everything you can to protect yourself, right? So that's why they did this study to find out if we can have any results on people who are taking medications that suppress their immune system. And so what they found is that depending on the drug people were taking, some of them completely suppressed their immune response a lot. Like in a normal, healthy human, we get nearly 100% antibody response. Like you give the vaccine to 100 people and 100 people will get an antibody to that vaccine. Whereas people who are taking immunosuppressants, there was a much smaller percentage. And it really depended on the drug. And so there's one type of drug that's really common in transplants called mycophenolate. It has several different similar names, but that's its main name, Cellcept. And people taking that drug had almost no antibodies. What's amazing is that drug works. It's doing its job. It's protecting that person from losing their organ transplant. Unfortunately, that also means it's stopping them from mounting an appropriate response to the vaccine. So if you're taking mycophenolate, it's really hard for you to get a vaccine response. Now, what I want you to know is this was only after one dose of the vaccine. We don't know what would happen after 2 doses, or even if maybe people who are on immunosuppressants should get 3 doses. We just don't know yet. So this is just the very first research that's out there, and I just wanted to share it with you as soon as I could so that you would know very top of line data. So they didn't break it out for people who are just on prednisone or other corticosteroids. they did break down who was on just mycophenolate or azathioprine. And so I'm inferring based on this data that essentially about 1 in 2 people who weren't on those drugs and were on prednisone or other immunosuppressants had about a 1 in 2 chance of the antibody response happening. So about half the people who got the vaccine might have gotten a response, half the people who didn't. They didn't really publish a ton of data on this, so that's my inference. It's not 100% clear if that's precisely what it is, but it looks about like 1 in 2 people who got the vaccine and were on certain immunosuppressants got an immune response. And that means the vaccine worked. 1 in 2 people, on the other hand, it didn't work. And so maybe it will work after 2 doses, maybe it will work after 3. We don't know. We just don't know yet. Okay, so then who were the people within that group who did the best? The people who did the best were younger, female, and, oh shoot, there was one more thing I was gonna say. Younger, not receiving antimetabolite maintenance, so that's not having that mycophenolate drug, and those who received Moderna. That was my whole point. Is those who received Moderna did a lot better than those who did Pfizer. Not a lot better, but there was a difference. And so if you have a chance to choose which vaccine you get, at this point, based on this one trial of extremely limited data, Moderna is your best option. That's all we know so far. Moderna is the best option compared to Pfizer. We don't have any other evidence for any other vaccine at this point. So if you or my sister or mom or brother, I would say sign up for the Moderna clinic whenever you can, because your chances are maybe 1 in 2 that it'll work, but that's a heck of a lot better than your chances if you actually get infected with COVID or you get infected again with COVID. It's like, you don't want to run that risk. So that's the first update. The second one was what the rheumatologist just came out with, and they said that the healthcare provider is responsible for engaging in a discussion in a shared decision-making process. So I love that. They want to talk to you, your doctors, and share this decision-making. They don't want you to just get it off the internet. They want to consult with you and be like, okay, you've got this going on, you've got this going on. Let's find, when is the best time to get it? Where is the best place to get it? Because if you're on other drugs like Rituxan, that was the drug I took. It's a chemotherapy drug. It also blunts your immune response. And so there might be a best time to take the vaccine compared to when you're getting the Rituxan. And so these are important questions you need to be discussing with your doctor. Okay, so those are the 2 things. And then number 3 is I got my second Moderna shot, and it was a beast. So I had read online that people on the second shot, it can be pretty tough. And the first shot for me was pretty mild. My arm was pretty sore, like I lost range of motion, but it went away, and I kind of felt exhausted that day. The second shot, on the other hand, I had a fever, I had aches and pains, I was really fatigued, I had a little bit of nausea. And so I want to tell you how to cope if you're on prednisone with these things that you're going to experience, especially if you're like me, you're female, because they found that women who get the vaccine have a harder time on that second shot. It's just, for some reason, the way female immune systems work, it's more vigorous. Like, we have much more side effects than the men, for whatever reason that is. I don't know. It's probably something to do with hormones. I don't know. Anyway, if you're like me and you always seem to be the one who experiences the side effect, then hear me out. So first of all, the headache. if you're on prednisone, you don't want to be taking ibuprofen or naproxen or meloxicam or any of those NSAIDs, because an Advil is a brand name of, and naproxen, these are brand names. You want to avoid those if you can when you're taking prednisone, because when you take prednisone along with one of those drugs, it can lead to a side effect that leads to gastrointestinal upset. Like you could get a bleeding ulcer, or you could get GERD, like reflux, heartburn, and pain. So if you are dealing with that headache and that achiness from getting the vaccine, then avoid those drugs, and Tylenol is probably a lot safer option for you. And if at all possible, if you don't need to take anything, then don't take anything. The very best thing we can do is allow our immune systems to mount a full response. And if you're taking prednisone, you need all the chance you can get. So only take a medication to cope with these side effects if you feel terrible. Otherwise, just try to tough through it, because you want to give your immune system every chance it can to mount that immune response. And those medications can dampen it. There's more research coming out that, like, it used to be, if there's a fever, we got to treat it. We got to give ibuprofen or Tylenol. We got to take it down. But there's more evidence showing that Mother Nature was probably smart in having fevers, that it really helps our immune system do its job. And so if you can tolerate a mild fever, then tolerate it. If it's intolerable, then you need to cope, right? And so that's what I'm talking about, is if you're suffering so much, you need help. This is the best way, is Tylenol, which is acetaminophen, instead of ibuprofen or those other drugs. That's the first thing. Then you could be getting nausea or vomiting. If that's causing you to not be able to keep food down, yikes, then you should take an anti-nausea medicine. I'm not aware of those have a drug interaction with prednisone. So yeah, feel better. And then with the fever and headaches in general, drinking lots of fluids is really important. And so if I had done it over again, what I would have done is I would have, the day before, I would have prepped myself for the vaccine better. What I would have done is I would have made food for like 2 or 3 days. I would have planned out breakfast, lunch, and dinner for 2 or 3 days and made it really easy for myself. Like something I could just throw in the oven, something I could just throw on the pot and not have to sit there and chop vegetables or anything, because I didn't realize how much I was going to feel like I just want to lie down. I don't want to have to do anything. And so that's what I've done first, is meal prepped for like 2 days so that we could get through it, or like have a plan of who you're going to order out to, right? Like get through it. Second, I would have had water by my bedside before the vaccine kicked in, and like a big jug of it, and then had that medicine there ready for me to take if I needed it, instead of just feeling awful in bed and not being able to like pull myself out of bed to take the medicine. So that's what I would have done to cope. So just having it all ready. Oh, and another thing would be a hot pad. That's what I would have done too. Because the aches and pains, that's a really great way to cope with the aches and pains that you can have for that day or two after the vaccine. So I would have had the hot pad ready, the water ready, meal prepped, and the medicine there within arm's reach, but I wouldn't have taken it. And I didn't take it until I was suffering enough that I was like, okay, I've given my immune system a chance to do its job, and now I need to sleep. Oh yeah, that was the other thing, is I couldn't sleep because I had such a high fever. And so I would take melatonin. Melatonin's been shown to help our immune system. I'm not saying it's going to help your immune system with the vaccine. I'm not going to say that. But in general, melatonin helps our immune system. And so I would have it right there, ready to take if I'm having a hard time sleeping because of my immune's it's doing its job when I'm feeling that way. but it's aggressive response to the vaccine. And then you're good. If you've got those things covered, you've got your water, your hot pad, your meal prep, you've got a Snuggly, I don't know if you've got one of those. You got little booties on your feet if you get cold feet when you have a fever. All of those things, get them all ready. Well, all those things that help you cope with a fever, have them ready, like a cold compress on your arm if it's aching, on your forehead for your fever. All of those things can help. And then the other thing I did wrong was I wore thick pajamas. And it was like, when the fever goes up and down, it was like, I need to take these off, but now I'm too tired to take them off. And so just wear thin clothes and have layers of blankets so you can take off, instead of like me where it's a lot harder to take off pajamas than a blanket. All right, what questions do you have about the vaccine, getting the second dose? I see a bunch of you are here. I'd love to answer them. And I'm really excited because my in-laws both have the vaccine completely done. And so that means my kids can be with their grandma again. Guys, like, they get to hug their grandparents without any fear of infecting them. You know, the grandparents are high risk. They're old. They don't want to be like, yeah, I'm the one who killed grandma. And it's so nice knowing that they can't do that now. Their grandparents are fully vaccinated. This is our ticket out of here, people. Get the vaccine, even if it only has a 1 in 2 chance of working. Maybe that means, like people suggested, maybe it means we need people who are on immunosuppressants, not just one vaccine, but maybe several different vaccines. Like maybe you'll get the full dose Moderna and then you'll get Johnson & Johnson too. We don't know. We just don't know that yet, but they're doing the research right now to figure it out. And that's why I came on today, to tell you the very latest information. And go get the vaccine, sign up. In my state, everyone over 16 is eligible. So you've got no excuse now, at least in my state. And just go get it. Have your plan already that I told you about. And I'm going to have a little printout of all the things that I suggested in here. So if you would like a copy of that, drop your email and I will send you a link below. Or you can send me an email at info@nutrinize.com. info at nutrinize.com. nutrinize.com. And I will send you an email with all of those tips I just shared with you. If you want to see just a little, like a 1-sheet printout, it'll be there. So, we have a question. Awesome. Bonnie says she's a kidney transplant patient and on prednisone, really scared to get the vaccine since it hasn't been tested on transplant patients. So if you missed the beginning of my live broadcast that I've just been doing, is I was talking about the trial that they just did. It was published in the most prestigious journal, JAMA, where they tested people with kidney, liver, lung, and heart transplants, and what kind of immune response that they got from the vaccine. And it showed that they didn't have any side effects worse than anybody else. What they did have was a less immune response to the vaccine. And it depends. If you were on just prednisone and other immunosuppressants, it might be okay. But if you were on mycophenolate in addition to prednisone, then your chance of vaccine working aren't very great. It was like 9% or something. It was really small. And so they have been testing. Like that's what I'm here is to say, hey, there's latest data. If you just Google JAMA, JAMA, vaccine transplant, you can read all about it. It's kind of in scientific ease. And that's why I wanted to translate that really medical language down to something more understandable for you. So if you missed the beginning, go back and watch the beginning of this so that you can hear that whole explanation. All right. If you have questions, please drop them below about the vaccine and prednisone. I want to keep coming out with the latest data for you so you know the best decisions to make. And if you'd like a copy of my best tips for how to cope with the second dose of the vaccine, or the first dose if you have a worse response than I did, just drop a link or your email address below and I will send it to you. All right? Signing off is Dr. Megan, your prednisone pharmacist. I'm here to help you not just survive prednisone, but thrive while on prednisone.